There's a couple of new things in shoulder surgery. The first is a type of anchor, and we use anchors to repair tears in the shoulder. And so for years, the anchors had either a plastic screw or a metal screw attached to the suture. The first anchor that was invented was a metal screw, and then with the advances in materials, they figured out how to make these with plastic. And so it's better to have plastic in your shoulder than metal, is my opinion. And then the most recent stuff, or most recent things that have been invented, are there's no screw at all attached to the suture. It's all suture, and the trick is the suture goes in small, and then it balls up underneath the bone, and it can't pull out because its surface area widens and it spreads out, and it can't pull out. And so it takes up a lot less of the bone. It displaces less of the bone. So that's an all suture anchor. And engineers have even invented knotless all suture anchors. So instead of us having to tie a knot, and the knot can in some situations cause some irritation, when you have a knotless anchor, it's basically a low profile implant that doesn't rub on anything in your shoulder. So it's a more natural profile of for instance, your labrum that gets repaired. There's no knot sticking up on top of the labrum where it's repaired that can cause irritation. The next other newest thing, and really a brand new thing, is called the Inspace balloon. And this balloon is basically inserted in a deflated state. It's inserted through poke holes, and then once you put it in the shoulder, it's inflated with sterile saline water. And what this does is cushions the ball from the ball of the shoulder, or the shoulder bone, from hitting the acromion bone or the shoulder blade bone. So it basically cushions the ball from rubbing against the bone. And this is for people that have a large retracted or a massive retracted rotator cuff tear that can't be repaired. And so instead of trying to repair that tendon, which we know will probably not work, we instead put a balloon in, and it cushions the ball from rubbing against the shoulder blade bone. And then the other option for those massive tears is the reverse shoulder. So if you can't repair the rotator cuff, then one of the common procedures to help the patient lift their arm is the reverse shoulder replacement. So basically, patients with a massive rotator cuff tear that's not repairable will be presented with several options, one of which is the reverse shoulder replacement. And then the newest option is the balloon. So there are two very different procedures. One is an incision in the front of the shoulder, and metal and plastic are put in the shoulder for the replacement. And the balloon is done through small poke holes. So they're very different procedures, but they are designed to fix the same problem, which is a large retracted rotator cuff tear.